right, welcome to Netilogue on CGTN. I'm Zhou in Beijing. Well, as the surge in the cases of coronavirus continues, cultural diversity has led to different approaches and sometimes misunderstandings in the fight against COVID-19 in different countries around the world. As part of our efforts to keep connected in the time of global isolation, we are honored to be joined on today's live webcast by internet influencers from the United States, the United Kingdom, Italy, Iran, Japan, and Israel. And viewers can also watch and participate. You can leave your questions or messages in the comment section of our social media account. At the same time, I'd like to also thank Weibo for their continued support of this program. Let me start with you in the United Kingdom, Zhang Peng. It seems that half of the world's population is now living in lockdown in one form or another. So life will continue, but with some restrictions. What is it like in the United Kingdom?
Well, initially, the UK citizens are not quite obey the rules. Well, before the restaurant shut down, they still go to the restaurant. But when government shut down the shops and shut down the restaurants, they seem to be now is getting used to this right now. And also film some of their actions already. Like even they go to shopping, they still try to keep the distance, like 2 meters away. So 3 or 4 weeks after lockdown, and the social distancing rules are quite well in the UK at the moment.
And Leo, obviously the United Kingdom is the last country in Europe, if I can stay still, a European country to have social distancing. Is it working?
Well, we're certainly a European country, first off, always will be. Yes, it is working. Last night, the Chief Medical Officer announced that the UK had already hit the peak of cases in the UK. And in fact, in London, the last few days, the number of cases has fallen by 5%. So clearly the measures taken are working very effectively. We're generally pretty confident that this is being well managed.
What about in the United States, Christian?
Well, I haven't left my house in about 10 days. But
10 days?
Last time I was out, 10 days. In Maryland, here in the Washington, D.C. area, a lot of people.
Stayed home for so long?
Yeah, I would say so. Well, I mean, 2.5 months ago, I was in Beijing, so I kind of went through the same thing, only going out for groceries. But, you know, people are starting to wear masks and everything. It's now required in the state of Maryland to cover your face whenever you go out. However, there are places like in Michigan and Ohio that there are actually protests with thousands of people going and saying that we have to open back up, lock up the governor for trying to shut things down. So not everybody's complying.
Where are you now?
Washington, D.C.
In Washington, D.C. Does D.C. also worry about what happened in New York will probably happen again in D.C.?
So from what I can tell, testing hasn't really scaled up that much in this area. We call it the Washington, D.C. area, being D.C., Maryland, and Virginia. And actually, I went and got a test 2 days ago. So
how about it?
Well, from what we can see, I mean, I'm still waiting for a result. They said about 3 days. So
why did you decide to test yourself?
I've had a fever for about 4 days. Body aches, soreness, sore throat. So
wow, that's
just to be safe, I guess.
Good.
Yeah, I've been sleeping a lot.
What about you, William? You're in Tokyo, I presume.
Yes. In Japan, about 1 week ago, the state of emergency was declared by the Prime Minister Shinzo Abe. But I want to say the emergency state in Japan is very different from other countries because all the emergency measures are actually request-based, which means it is not legally compulsory. Actually, the government is encouraging people to stay home and also asking the restaurants, the shops to limit or cease the operational time. But actually, because the state is not mandatory, some restaurants did close, but others didn't. People are also free to go outside and go to work, even using the public transportation system. Anyway, in the world, I think that the lockdown in Japan is a very soft one, and it is very reliant on the awareness of the citizens themselves.
What about you, Roz? What is it like living in quarantine in Israel?
Hi, I'm right now in Israel, and the number of cases is around 12,000. For a small population like us, it's quite significant. So the country is in full quarantine, especially now during our holiday period, the Passover holiday. And there's actually some cities on complete lockdown that they cannot leave, and nobody can enter or leave. Israel is taking it very seriously, and people are obeying the rules for the most part.
What about Iran? Rezo was probably among the first countries to see infections. And Iranians have religious rituals to go to. Do they stop? Have they stopped doing that?
Yes. Hi, first of all, hi. I am Arizu from Iran. And first case of coronavirus has been noticed and reported on 19th of February in Iran. And up until now, by having around 75,000 cases, confirmed cases, and around 5,000 death cases, already our country is the most affected country in the Middle East. So in response, our government tried to take some steps like stopping schools and universities and let them just continue working online, and also stop some public events and celebrations, important celebrations, and also stop the Friday prayers and holy shrines and things like that. So of course, at the beginning, some people were unhappy because of all these lockdowns and everything, but nowadays everything has become to normal. I mean, people have used to that, and there is no complaint about that thing. And in Iran, there is no official lockdown or quarantine on any city or any area.
What is the most difficult part of living in quarantine, and what is the satisfying part of it? Zhang Peng, how about you?
Well, for me, work is not a problem because I've always used to working from home, even in my blogging business. But one of the most challenging things is to getting enough food, because my parents visit me because I have a baby born last year. So all my parents and my parents-in-law are here, so we have a big family household here. It's hard to get these foods delivery to us. It's hard to go outside because in this environment.
And I know, Christian, that you got a chance to take a up-close look at the temporary hospitals in your area. What is it like, and can the U.S. public health system handle the pressure now?
I mean, in Washington, D.C., it's not as severe as in, New Jersey, New York, Michigan, but the place that I went to, it was actually just in a parking lot of a little shopping center, with a 7-Eleven and like some little pharmacy. And they just told us, all right, we're going to be doing the testing at 6:30 p.m. So I pulled in the car, several other people around there waiting for a while, and it just kind of was, weird, like tension, because it's generally like a fairly empty, unsuccessful shopping center, and then all these cars started pulling up with nobody getting out. So we're just sitting there waiting, and then finally all these people came out,
Did you pay for the testing?
No. I bought insurance because I live in China full time, so I bought insurance the day that my wife and I landed in Washington, D.C., just assuming that we'd be here for 2 months or so. And then when I found out I needed the test, they said that actually the insurance that I got fully covered it. So the consult with the doctor, the test, that was all free. And if you don't have insurance, the current policy is $125.
What about in the United Kingdom? Do people pay for the testings? Leo?
So in the United Kingdom, we have a 100% free national health service. Every element is free at the point of use. So no one is paying for any testing, no one is paying for any treatment at all. The issue right now, of course, is that we don't have enough testing, and they're fighting very hard to increase the rate of testing to 100,000 tests a day by the end of the month. We're quite a long way from there, but I think we'll make it. But no, we have completely free healthcare for every person inside the UK, including our visitors.
What about in Israel, Raz?
In Israel, we have a very special testing system. First of all, it's all for free. Secondly, they come to your home. People come to your home to do testing, especially for the elderly and the people that cannot leave.
They
And for the
come
ones who
to
could
your
leave,
home.
Yes, the testers come to your home dressed up in a suit, and they take it for 2 minutes, and they leave.
Because it's easier for you, but
Right.
it's cumbersome for them.
Right, it's dangerous for them, and it's a system mainly caring about to protect the hospitals from possibly being infected by people going to the hospital, to the centers of the health, and also for people who cannot leave their homes, like maybe very elderly or people that are have trouble getting to the hospital. So it's a unique system, and there are people really everyday testing, running around. I have a good friend of mine, one of my best friends. He's a paramedic. He's a medic, and he goes and tests around 50 to 60 people a day.
But probably not many countries can afford to send their medical doctors to homes to do the testing.
That's true. Yeah, it's a unique system, and it's helping to increase the testing and keep people safe. But obviously, we hope all the doctors and medics are being safe and careful when they go and keep the society safe.
I know that Zhangpeng, you had a chance to videotape some of the VHF facilities doing testings. Was it like to do testing in the United Kingdom?
Well, that's at the early stage of the coronavirus, where UK still have enough testing facilities to test those patients. That's at the early stage. But so they thought to isolate these people who needed tests, so that they don't need to go into the hospital. They can just test it outside the hospital. But after in early May, when the pandemic broke out, UK doesn't have enough facilities to test all the people. So the testing process are limited to those patients who are ill enough to be admitted to the hospital, so that the doctors know whether he got coronavirus or not, so that the treatment will be in accordance with that. For any other patient with mild symptoms, they will never get tested. But since 1 or 2 weeks ago, the government are extending these testing capacities to these NHS workers who show some symptoms in the past but who want to go back to work, so that they will get tested these days, so that they will know whether they can go back to work or not.
All right. As this coronavirus continue to spread, we seem to have seen people doing things otherwise they wouldn't do, like hoarding goods, like pasta, toilet paper, canned food. And William, is it the same in Japan? People are buying all kinds of stuff? Anything that's particularly Japanese?
I think at one time in Japan, people did rush to buy a lot of toilet paper at one time, because it was resulted from a rumor on the internet. I think the rumors was saying that most toilet paper in Japan are made in China, and because of the impact of the coronavirus, all the factories in China are stopped. So it is very urgent to buy something like toilet paper before running out. Yes, that's the reason why people rush to buy toilet paper during that time.
What about Israel, Raz? Is super working good? Do people line up to buy?
The main situation is because it's a very big holiday for us, Passover.
Yeah, that's a big holiday for Jews.
Yes, it's a very big holiday in the Jewish calendar, and for some reason, eggs were in short supply.
Eggs?
There was a big rush. Yes. My mom went to the supermarket, and she always complained there was no eggs for around 1 week. You just couldn't get it. And then the Israeli, I think it was an Israeli government, they did a massive purchase of eggs from Turkey and Spain, and they flew it literally right away just before the holiday, so people could have eggs, because a lot of the dishes we cook in our food involves eggs.
Okay.
So we solved it. I think now you can only buy 2 cartons of egg per family, like per shopper, like about I think it's about 40 eggs or 20 eggs, or 30 eggs per person. Yeah, but that was the main situation. Everything else has been actually okay. Of course, people are trying to get masks, which is still hard to get. But besides that, we don't have the toilet paper rush for some reason. We don't. We're okay with toilet paper in Israel. Nobody was rushing for that.
Okay. Aldo, what about Milan?
Yeah. Italians are now. I can say they changed a lot. It's just very difficult, I think, for everyone because we are used to be very close to each other. But I think Italy is doing good now, and we are keeping the distance. Everyone is wearing masks for going outside, and if also you cannot go outside without a face mask. And and for the groceries, we had some problems for one day that everyone was going and taking everything, but the day after everything was there. So it was just one day issue.
About wearing masks, because that's really interesting. 2 months ago, everybody wore masks in China, in Japan, but many Western countries say this is strange. It's just unreasonable for healthy people to wear masks. But now it seems everybody is okay wearing masks. Why there is a shift of attitude there? Leo, is British comfortable wearing masks?
Well, I think there are two issues. Firstly, we have no history of wearing masks, of course. China has been through SARS, and China has been very concerned about air quality issues. So they have 20 years experience in wearing masks, and we have none. But I think the deeper issue is really a government-driven issue. There actually are not enough masks in the world to meet the needs of the world during the epidemic. China produces 90% of all the masks in the world, and China produces 116 million every day. Now, there are 40 million doctors and nurses
China is
in the
now
world.
selling to the rest of the world.
And China is giving them away, and everyone appreciates that enough. But if you think about it, there's 40 million doctors and nurses in the world. If China produces only for them, there is still not enough for them to use for one single morning every day. So what the British government did at a very early stage is it said to everybody in the country, wash your hands, stay at home, you don't need a mask. And I think what they really meant is leave all the masks, we need them for the nurses and the doctors. And they made a huge effort to stop the public buying them. Just keep them at home, wash their hands, and make sure all the masks go to the people who need them the most. I think that's really what's driving it.
But it seems that the Japanese are always okay to wear masks on the streets, in offices. There must be some cultural elements behind this. William?
Yes, I think so. The Japanese people always have the habit of wearing masks, even long before this pandemic, I think. There are multiple reasons for that. I'm not sure, but there is one reason I'm pretty sure. It is in spring, many Japanese people are actually allergic to the pollen, which causes symptoms like sneezing and runny nose. And that is one reason. And there is another one kind of fun, interesting. It is also said that young Japanese girls are wearing masks to cover their faces. If they don't want to make up that day or for fashion only. And because
Really?
of that kind of culture, yes, I think so. I think so.
Is fashionable to wear masks?
It depends. It depends on the kind of mask.
Wow, that really beat me. Yes, there are a lot of people worry about, probably masks is the least of them. A lot of people are living anxiety, uncertainty, and sometimes desperation. You are influencers. You are opinion leaders in a way. How do you help your followers cope with psychological strain and emotional stress?
Well, during all these days, I have tried to use different things in different ways to entertain, challenge, and encourage, and of course, motivate my followers. I mean, by having some cooking challenges, and also sometimes even by telling them all the positive things that this situation, the virus situation, brought to the world, brought to the humanity. And also sometimes I even try to use this, to use my platform to just tell some stories to Chinese people, because I know Chinese people love hearing the stories, especially when it is a real story from another culture. So they want to hear that. So it's a way to keep them entertained, to keep them happy or distracted from whatever that is happening in the world.
Yes, yes, indeed. And the cooking lessons definitely help. All of us have gained weight. What about you, Lila? You still reach out to your followers?
Yeah, so I mean, I think it's a really interesting question because I think a lot of content creators are kind of struggling thinking what kind of content should I be making at such a sensitive time, and viewers are also, you know, thinking what should I be watching. So to be honest, I think that there are two ways of dealing with the pandemic as an influencer. So I would say one is to address issues and provide a platform for discussion, and the other is to provide an escape for those kind of who want to break from hearing all of like the COVID-19 related news articles and things like that. So I think that at Why China as a platform, we've provided both. We've addressed issues like discrimination and rumor spreading that are really important to bring to light and open a dialogue about. But at the same time, we've also been releasing more lighthearted videos so that viewers who are feeling distressed or bored can kind of like hang out with us, and hopefully we can bring a smile to their face during such a difficult time.
Wow. Well, thank you very much. Thank you to all of you for keep up the good work and connecting with your followers and passing on those information. Now I would like to answer some questions from the followers and the social media users on Twitter from Sienna Espacito. Guys, where do you want to travel once the travel ban is lifted? Well, that's a very personal question. Leo, where do you want to travel to?
Well, right now my wife is in Xiamen and her parents are in Wuhan. So I want to go to Xiamen and Wuhan, and I want to see family.
You definitely should see Wuhan.
Yeah, I want to see my family.
What about you, Christian?
I just want to go home to Beijing.
Welcome back.
Number one priority for me. Yeah, I mean that's where everything is. That's where all my friends and coworkers are. My in-laws are still there. So, you know, it's an unplanned trip to be away from Beijing for this long, and I really want to go back.
Roz?
I would love to go back to China as well, and of course to see my friends again. But actually, one place I want to go to is Huanggang.
Why there?
It's a city in Hubei because Huanggang, because there is Huanggang. It's a city where we have donated many masks to the hospital there.
Okay, I get it.
They really want me to see the situation there right now, and I've never been there. And obviously going to Hubei and traveling there, making videos there, show the world what it's like. I think it's a great opportunity to show the world more positive sides of this area and not just the sad stories from the last few months. Yeah, and of course I want to go watch a football game. So anywhere, I would go to England to watch Chelsea. I would go to Spain to watch Barcelona. Anywhere there's football, I miss it. Where's my football games?
And to be clear, for all those sports fans, it's really excruciating, painful period. We can't watch any game at now. That's really.
I've been watching many games from the past. I've been watching like from 2001.
But it's different to watch games live and watch games of the past. All right. I hope your dream will come true sooner. Aria Chan, through YouTube, she asked, did you guys make any permanent life changes because of the coronavirus? How will this change our life? This is important. Because the change of life also makes us think about what is important in life. That is really very important. What about you, Roz?
Well, I just hope that we all pay attention more to the real heroes in our society, which are the doctors, the nurses. I think we managed to really, in the future, we will all be very, very appreciative of these people more. I think we will take more care about their situation. We'll give them more funding. We'll give them more materials. We'll be more prepared for the next, if there is a next epidemic, we must prepare better. And we will be able to I think as a whole we'll be able to understand which are the people that are really fighting for us, as well as paying attention to the elderly. I think that's something that, you know, they've been suffering so much from this. That's the most. They're the most deaths, the most sick. And spend more time with your grandparents and your parents when you can. This is tells you they, you know, something like this comes and might endanger their lives. So why not give them more phone calls, see them more as you can? I think, you know, these are the real heroes in our lives, our families and our doctors. And that's pretty much what I have to say.
Yeah. Keep close to your families. That's always number one. Thank you, Roz. And Lila, what do you want to say?
Yeah, like Raz said, I think this is really a learning experience on so many different levels. And I also think that, you know, if we can get through this, we can get through anything. Because right now, doing, you know, anything, even things that used to be so simple, like having a meeting, have become so much harder. So it's kind of like, I feel like, you know how sometimes, like, when you work out, you put, like, weights on your arms or on your legs, and then your whole workout becomes really hard, but it's making you stronger. And then you take off the weights and you feel, like, so strong and you're so much better all of a sudden.
Wow,
I
that's a
think
good
that, like,
metaphor.
the coronavirus is kind of like our weights. And once, you know, we get to take off the weights and everything goes back to normal,
Yeah.
you know, we'll all enter back into regular lives in full force and become stronger than we ever were.
So interesting. Thank you all for your wonderful ideas and sharing this with me. The fact that we are talking in this way says a lot about the world that we are living in. Maybe COVID-19 has changed our lives one way or another, but we are talking about it, we're dealing with it. The fact is that we are in this together. So why don't we end with shouting some slogans showing that we are in this together. Let's say the slogan that we have, fight as one, 战疫情战一起. Let's say it together. 1, 2, 3. Fight
as one,
one,
战疫情战一
Fight as
起.
one.
Thank you so much. And at last, I'd like to invite Mr. Aldo Cecchini to play some music for all of us so that we can end with a happy note. Aldo, play some music for us.
Okay.
Woo.